All right, welcome. In this session, we're going to do a really thorough breakdown of the osteology of the lower limb. We're going to take a systematic approach here, building up your knowledge piece by piece, starting right from where the leg connects to the main skeleton.
Okay, so here's our roadmap for this session. We'll kick things off with a general overview. Then we'll get into the pelvic girdle, move down to the thigh with the femur and patella, then the leg with the tibia and fibula, and we'll finish up with all the intricate bones of the foot.
All right, let's get started. The first thing we need to do is think about the lower limb skeleton in terms of its two main functional parts. So you can really think of it like this. On one hand, you've got the pelvic girdle. This is the anchor, right? It's what connects your entire lower limb to your axial skeleton, your spine and your trunk. Then you have the bones of the free lower limb. This is everything else, the thigh, the leg, and the foot, all the parts that are actually responsible for moving you around.
Okay, so let's zoom in on that pelvic girdle. Now, this is an absolutely critical ring of bone. Think of it as the foundation. It's formed by the sacrum at the back, and then you have the two hip bones that wrap around the sides and meet at the front. Now, each of these hip bones, which we call the Os Coxae, is fascinating because it's not always a single bone. You see, when we're kids, it's actually made up of three separate bones, the ilium, the ischium, and the pubis, and they're all held together by cartilage. But as we grow, they fuse together to become that one solid hip bone that we have as adults.
So why is the pelvic girdle so important? Well, it really has three key jobs. First, it's that super strong attachment point connecting your legs to the rest of your skeleton. Second, and this is a big one, it's responsible for transmitting the entire weight of your upper body down to your lower limbs. And third, it acts like a protective bowl, supporting and shielding the organs inside your pelvis.
Okay, let's break down that hip bone, starting with the first of those three parts we mentioned, the ilium. This is that large, fan-shaped superior part of the hip bone, and you can actually feel this on yourself. When you put your hands on your hips, that bony ridge you feel, that's the top of the ilium, the iliac crest.
Now, let's dig into the specific landmarks on the ilium, and these are absolutely crucial to know. First, we've already mentioned the iliac crest. That's the hands-on-hips spot. Then, on the front, you have these 2 points, the anterior superior and anterior inferior iliac spines, or ASIS and AIIS for short. These are major attachment points for key thigh muscles. On the back, you have similar posterior spines that anchor powerful ligaments. Now pay close attention to the greater sciatic notch. It's this big, U-shaped cutout that allows the sciatic nerve, the largest nerve in your body, to pass through. This is clinically huge because if that nerve gets pinched here, that's what causes sciatica. Lastly, you have the auricular surface. It's got this ear-like shape, and it's where the ilium connects with the sacrum, forming that all-important sacroiliac joint for weight transfer. All right, next up, we have the ischium. This is the strong part of the hip bone located towards the back and the bottom. You probably know it better as the sitting bone, because when you're sitting down, this is the part that's bearing your weight. So let's look at the landmarks on the ischium. First, and most importantly, is the ischial tuberosity. This is that rough lower area that you're sitting on right now, and it's also where your hamstring muscles attach. Then you have the ischial spine, a sharp projection that separates the greater sciatic notch from the lesser sciatic notch. You'll also see the Obturator foramen, which is that really large hole formed by both the ischium and the pubis. It acts as a passageway for important nerves and vessels. And finally, the ischial ramus is the bar of bone that connects the ischium forward to the pubis. And that brings us to the third piece of the puzzle, the pubis. This is the bone that forms the front and bottom part of the hip bone. It completes that bony ring at the very front, where it meets the pubis from the other side at a joint called the pubic symphysis. Now, this is really interesting because it highlights a major difference between the male and female pelvis. If you look at the pubic arch, that's the angle formed right below where the two pubic bones meet, you'll see it's much, much wider in females. And there's a very good reason for this. It's a crucial adaptation to create a wider opening to make childbirth possible. And here's where it all comes together beautifully. Those three bones we've just talked about, the ilium, ischium, and pubis, they all fuse together to form one critical structure, the acetabulum. This is the deep, cup-shaped socket on the side of your hip. It's the socket part of the ball and socket hip joint, and it's perfectly designed to receive the head of the femur. All right, so moving on from the pelvis, let's travel down into the thigh. Here we're going to look at two bones, the femur and the patella. First up, the femur, and this is a major landmark. It is the longest, the largest, and the strongest bone in your entire body. And when you think about what it has to do, support your full body weight and act as a lever for all those powerful leg muscles, it makes perfect sense why it's built so tough.
Now, let's compare the top part of the femur from the front versus the back. On the anterior or front side, you have the intertrochanteric line. It's a rough ridge connecting the two trochanters. But if you flip it around to the posterior or backside, you'll see the intertrochanteric crest, which is a bit smoother. And also on the back, and this is a really important one to remember, is the Linea aspera. It's this long, prominent ridge that serves as a huge attachment site for many of your major thigh muscles.
And what about the patella, or as you probably call it, the kneecap? Well, it's a special type of bone called a sesamoid bone. That just means it's a bone that's embedded within a tendon, specifically the quadriceps tendon. Its main job isn't just protection, it's mechanical. It acts like a pulley, increasing the leverage for your quad muscle. This makes you much more powerful when you extend or straighten your knee.
Okay, let's keep moving down. Now we're in the leg, and remember, in anatomy, the leg is technically the part between the knee and the ankle. And in this section, we've got two bones running side by side, the tibia and the fibula. Now, it is absolutely essential to understand the difference in function between these two. The tibia, your shin bone, is the big one on the medial or inner side. It's the workhorse. It bears all the weight. The fibula, in contrast, is the more slender bone on the lateral or outer side. It's non-weight bearing. Its main jobs are to serve as an attachment point for muscles and to form the outer part of the ankle joints. You can feel both of them at your ankle. The inner bump is the medial malleolus of the tibia, and the outer bump is the lateral malleolus of the fibula.
Okay, let's pinpoint some key landmarks on the tibia. You can feel a lot of these yourself. That bump right below your knee tap, that's the tibial tuberosity, where your patellar ligament attaches. The sharp front edge of your shin, that's the anterior crest. Now, up on the very top surface of the tibia is the intercondylar eminence. This ridge is incredibly important because it's where your crucial knee ligaments, your ACL and PCL, anchor themselves. And finally, way down at the bottom, you have the medial malleolus. That's the prominent bony bump on the inside of your ankle.
All right, we've arrived at our final stop, the foot. The foot is an incredibly intricate structure with 26 bones in total. But don't worry, to make it easier to understand, we can organize all those bones into 3 distinct groups. So here are the 3 sections. First, you have the tarsus, which is a group of 7 bones making up your ankle and heel area. The 2 most important ones to know here are the talus, which connects to the tibia, and the calcaneus, which is your heel bone. Next, moving forward, you have the metatarsus. That's the 5 long bones that form the main body of your foot. And finally, you have the phalanges. These are the 14 little bones that make up your toes.
Now, there's one last very important detail about the phalanges that you absolutely need to know, especially for exams. Your big toe, which we call the hallux, is different from the others. It only has 2 phalanges, a proximal one and a distal one. All of your other 4 toes, however, have 3 phalanges, proximal, middle, and distal. So remember that count, 2 for the big toe, 3 for all the others. It's a fundamental point for understanding the structure of the foot.